Thank you, Mr. Speaker. My question is to the Minister of Health. Does he stand by all his statements regarding health services?
The Honourable Tony Ryle.
Yes, including my statement that despite doubling the health budget, the Labour government actually got less in the health service.
The Honourable Ruth Dyson.
When he says that resources are going to the front line, does he mean the community of Tangi Moana, where the nursing clinic hours have been cut from 20 to 8 and the days when patients can visit slashed from 6 to 2?
The Honourable Tony Ryle.
Mr. Speaker, more good news from the National Government. I'm advised that the nursing service that people from the rural township of Tangi Moana have been receiving resumes on Monday. In the meantime, people who need... This is a service being provided by the local PHO. In the meantime, people who need regular nursing attention are getting it from a nurse visiting from the Manawatu PHO.
The Honourable Ruth Dyson.
When he says resources are getting to the front line, does he mean the Nelson nurses who fear cutbacks are putting their patients' lives at risk, where nursing vacancies are not being filled to save money, and where nurses are so pushed for time they're not even able to file serious incident reports?
The Honourable Tony Ryle.
Mr. Speaker, regarding nursing issues at Nelson Marlborough, I've been advised by the Chair that there are 20 more nursing personnel employed at the Nelson Marlborough Hospital than there were when the government changed. There are also 23 more medical personnel than when the government changed. We have inherited a worsening financial situation at Nelson Marlborough, and that does create uncertainty for staff and the community. Last year we increased the budget by $13.5 million.
Dr. Jackie Blue.
Thank you. To the Minister, why are DHBs reviewing the way they deliver some of their services?
The Honourable Tony Ryle.
Mr. Speaker, as the members know opposite, we inherited a very difficult situation of district health boards heading towards a track to financial ruin because they did not have the resources and the staffing and the approach needed to benefit services. Despite doubling the health budget over a 9-year period, that government managed to deliver fewer key services.
The Honourable Ruth Dyson.
How many consultants will the National Health Board and the Ministry of Health have to hire this year during the influenza season, given that last year, just days after the Ministry's communications staff member was made redundant, they hired 2 consultants to cover his communications for the swine flu epidemic?
The Honourable Tony Ryle.
Mr. Speaker, I can tell the member that spending on consultants in the Ministry of Health is down from what it was under that party opposite.
The Honourable Ruth Dyson. Order. I say to the members' colleagues that the Honourable Ruth Dyson has the call.
Mr. Speaker, does he agree with Eric Roy, described by Grey Power as unaware of the hardship being caused in Invercargill, who said in the Southland paper that if home support for older people was not cut, then core hospital services would be cut? And if so, what cuts will be needed in Southland in the coming 12 months when their budget increase is halved?
Honourable Tony Ryle.
Mr. Speaker, there's no doubt that the Southern DHBs received about $28 million extra last year, and I can assure the member opposite that they will be receiving a record budget this financial year.
Jacinda Ardern.
To the Minister, does he agree with a recent Ministry of Health commissioned report on youth health that found general providers, quote, were not being accessed by youth, but in contrast, quote, youth one-stop shops successfully provide a range of specialised integrated health and social care services for the youth of New Zealand, and many are at capacity? If so, why is he allowing services in Christchurch and in Invercargill to face closure on his watch?
Honourable Tony Ryle.
Yes, that's quite right. Mr. Speaker, with respect to the 198 Youth Centre contracted by the Canterbury District Health Board, I've personally been in touch with the chairman, Mr. Alistair James, who is taking a personal interest in this cause. Mr. James advises me that the DHB still has $410,000 earmarked to assist this service, and discussions are ongoing.
Honourable Ruth Dyson.
Does he stand by his statement, and I quote, "There do have to be some changes made to services because we have to make sure that the funding goes to places where the public gets the best possible outcome of health spending." And does he think that cutting nurse positions, their hours and their clinic times is going to give the best possible outcome for patients?
The Honourable Tony Ryan.
Mr. Speaker, the latest available information from the Ministry of Health suggests that we now have 1,100 additional nursing personnel since I became the Minister of Health. Nurses around New Zealand are having more time to work with patients, and there are more nursing personnel.
Order. Before I call the honourable member, I must say, if it relates to the answer the Minister was giving, I'm struggling to assist her because I couldn't hear because of the unnecessary interjections that had nothing to do with what the Minister was saying coming across the front of the House here. And I'd ask members on the front benches to
point
assist.
of order.
Point of order, the Honourable Ruth Dyson.
I did hear the Minister's answer. My point of order does relate to it. You didn't miss much, frankly,
Order.
Mr. Speaker. But
the Minister mustn't do that.
But my point of order is to ask the Minister if he was quoting from an official document when he referred to the 1,100 extra nursing positions, and if so, ask that he table that document.
Was the Minister quoting from an official document?
Not an official document in the sense that it's prepared by any Ministry of Health. It's essentially a schedule that's been taken off the Ministry of Health website.
A point of order is being considered, and this is a slightly different situation, but had it been notes prepared for the Minister's answer in the House, that would not be considered an official document. If it is actually a schedule, unaltered, taken from the website, I imagine that would be an official document.
It's prepared for my answer.
It's been prepared for the Minister's answer. Order. I'm considering a point of order. I do expect the House to be in silence. I have to take the Minister's word. If he's telling the House, order. If the Minister advises the House that the material he was quoting from is material prepared for his answer, then the tradition of the House is that is not considered to be an official document. Quick point of order, the Honourable David Parker.
I'm somewhat confused because I thought the Minister...
A point of order is being heard.
I thought the Minister said it was a schedule printed off from the Ministry of Health website, in which case it is an official document.
Order. At the end of the day, I have to take the Minister's word. He's told the House, he's told me as Speaker, that the material was prepared for his answer and is therefore not an official document.
Point of order, Mr. Speaker.
Point of order, the Honourable Trevor Mallard. Order!
That was Paula Bennett, just to be clear, that score.
It's all right. The member, I've called him and he will make his point of order and there will be silence.
My request to you, Mr. Speaker, is that you review both the Hansard's, the tape of the Hansard and what was said by the Minister on the two interventions he made on that question to ensure that you were not misled by him as he changed his mind.
Yes, exactly.
Order. The matter, I think members, if they reflect on what's happened, will see how this matter can be taken to a ridiculous extreme. I mean, most material used in preparation of an answer has probably come electronically from some document or other. And if a sentence or a small table is taken from a document or a table is taken from a document to prepare information for a minister's answer, that doesn't constitute a document. And I think the minister has advised the House that this is material taken from a website to prepare for him to answer a question, and that is where the Speaker, if the Speaker is to treat it in any other way, the Speaker is not accepting the word of a member. And I accept the word of all members, and that is the end of the matter. Question And I point out it's the end of the matter, the Honourable Clayton Cosgrove.
I'm not challenging your ruling, sir.
I should hope not.
I'm not. I'm just simply asking, based on, I think Trevor Mallard has made a reasonable request.